Carnage on Britain's roads.
They've just had a road traffic collision.
Danger around every corner.
There are significant injuries. There's patient breathing.
Motorcyclist versus car. He was hit from behind.
Every 16 minutes, someone is killed or injured.
Stay with me. Stay with me. Look at me.
When you get behind the wheel,
Hello, mid 5-3.
your life is in your hands.
Can I put a trauma alert to resus coming by air?
And if things go wrong,
Steady, lift.
elite trauma teams pick up the pieces. University Hospital Coventry tackles some of the most extreme cases in the country.
What's happened?
You're in hospital.
Last thing I can see was a tractor and I ploughed into it.
I can't remember what happened. Her car's ended up on its roof.
From crash scene
Where's it hurting?
All down my side.
to A&E,
Until we get a CT scan, I need you to stay nice and still.
Patients can die from this.
and emergency surgery.
This may not be a reconstructible injury. She could lose her hand.
If we can't stop him bleeding, he won't survive.
I honestly thought he was dying.
We follow the medics battling to save the lives of casualties
Oh, my life!
injured on Britain's deadly roads.
You never think it's going to be your kids.
Tonight, car crushed under tractor.
I can't feel my arm.
Those kind of things need to be rectified as soon as possible. We don't want David to lose a limb.
A paramotor crash landing from height.
This is Roger. He's a 44-year-old male.
We are concerned about his entire body.
Oh, life!
Literally got head-on with a car.
And a motorbike smashed by car.
Got into a motorbike accident and my leg might be broke.
It's 3:30 p.m.
Hello, mid 5-3. What we got? An RTC. All right, we'll give you an ETA en route.
42-year-old male. Tractor collision. Helicopter crew dispatched.
And the patient is coming by air as well, is it? Perfect. Lovely. OK.
That's the buzzer going off. That's a trauma alert. So when there's a trauma, i.e. a physical injury of note, they'll give us a heads up in advance and they'll be coming in so we can get things ready and get the team together as well.
Serving almost 6,000 square miles, the helicopters can often reach patients in under 10 minutes.
Cheers.
It is a male 42-year-old car versus tractor, possible humeral and radial fractures and a wound to the eye. Observations are stable, but just because of the extrication and everything like that, took a little time to get him out.
Stop all traffic and pedestrians. Stop all traffic and pedestrians.
This is 42-year-old David. At about 3:15, he was driving his car on a small country road. He had head-to-head with the tractor. The wheel of the tractor went sideways, and his car sort of went under the tractor mechanism. He was physically entrapped in his car by his steering wheel and the seat being pushed forwards and the whole mechanism sort of being down. It took a while to get him out.
One thing that we talk about when a road traffic accident comes in is how the patient got out of the car. So, for example, when people have to start getting cut out of cars or being extricated by other people or other specialist teams, automatically we know that one, the accident might be worse, and therefore two, the injuries might be worse as well.
His injuries are a complex wound on his right forehead involving the eyebrow, closed left humeral fracture, closed left distal radius fracture.
What happens when a car hits a heavy-duty motor vehicle? A car is designed with a crumple zone to protect the driver and absorb the main force of impact. But during a head-on collision, the body would struggle to cope with the potentially fatal G-forces decelerating to a standstill. In David's case, crushing his car underneath the 3-ton tractor with no crumple zone. Common injuries from head-on collisions are internal, spinal, limb fractures, and brain injuries from blunt trauma.
Just looking at your neck, we're going to do a top-to-toe David, okay? So feeling your neck here, trachea is very central. Deep breath in for me, David. No pain when I'm tapping? Radial. We'll be careful of this arm, David. Just going to sneak in there. David had a significant trauma. Obviously, he's in a car against a tractor, which isn't a good fight for anybody. And he's come out. Two things really. One, he's got major injuries to his arm. That itself is a hint that there's maybe more going on. So the safest thing, especially because he's got some tenderness on his chest, he's got a significant injury to his head, we're going to do a CT from head to pelvis and make sure we don't miss anything on the inside, basically. Now, we're waiting for those scan results to come back. Once we get the all clear from there, there's nothing drastic going on, then we can have a look at your arm, which I think is really the main event. Okay?
Hello, touch darling. I'm in the hospital. I've gone head on with a tractor, and the tractor's gone over me, and I'm in a pretty fucking bad way, actually.
Oh, fuck.
I'm in Coventry Hospital.
Fucking hell, you that far?
Yeah, literally going around the blind corner, and a tractor didn't have enough time to move or anything, and it went straight over us. All right.
Right, I'm ringing you now, okay?
Okay, love you, darling.
All right, keep the baby, brother.
All right, bye.
All right, bye.
The last thing I can see was a tractor on the opposite side of the road. Then I ploughed into it. No chance of putting on the brakes or anything. I'm a builder by trade. I've just got kit everywhere. I might have to take a phone call and get that all together, and my car's a write-off. Bloody hell.
So David's CT's come back. The things it has picked up is one, a hematoma, which is like a bruise or a swelling on the right orbit. We kind of know that because it looked like he had a big cut there. There is also 2 bends in 2 of his ribs. That's called a buccal fracture. But because he's breathing okay, his oxygen's okay, we don't need to do much more about that. It's actually picked up a fracture of the humerus, which is a bone here, and is bent with it. Also a bad fracture of the wrist, and that's in multiple pieces.
I can't feel my arm. Yeah, not great.
You said that you can't feel your arm?
No, this arm is really hurting.
So it's hurting? I just want to double check. Okay. Does it feel the same on that side or different?
Same.
Sure? Okay, fine. So the touching feels about the same?
Yeah.
Good. But just feels overall a bit numb?
Yeah.
Crush injuries, just from the name of it, you can imagine how much force is involved and how painful it can be. I think sometimes people mistake bone injuries as the main thing we worry about or care about. But around the bone, there's so many more small nerves, vessels, soft tissues, and other things which can take a lot longer to heal. So we actually get a lot more worried about that. If people start getting numbness or signs that they might be losing blood supply to the limb, we have to sort that out straight away, because losing a limb is one of the worst things that can happen to someone and can be a life-changing event.
But you can definitely still feel me touching?
Yeah.
So David, if at any point that goes completely numb or feels worse, you must let me know. So that's your main job, is to keep me posted, all right? Okay. Sometimes if you break a bone or have a bend, it can affect the blood supply or the nerve supply. And those kind of things need to be rectified as soon as possible. Otherwise you lose a limb. We don't want David to lose a limb.
Coming up, motorbike crushed by car. Paramotor collision.
He's had 20 milligrams.
Causes devastating injuries. In 2022, over 61,000 road traffic accidents involved men under 49. They account for 75% of all fatalities. They are also 3 times more likely to take part in high-risk activities, which cause major traumatic injuries. University Hospital Coventry trauma team are on standby for one such case. 44-year-old male crash-landed a paramotor 30 miles from the hospital. Difficult road access. Helicopter medical services dispatched.
So this is Roger. He's a 44-year-old male who, at about 20 past 10, fell from a paraglider while he was coming into land. He has been GCS 15 with us the whole time, but there's a bruise on the front of his head, and complaining significantly of pain in his right leg.
So I'm just going to quickly check you top to toe, check how you're doing.
In general, because of the nature of the trauma, we are concerned about his entire body.
You've got good air entry to the left face. And a quick feel of your tummy, Roger.
Right now we've managed to do a primary survey on him. We've identified the injuries of concern. There's an open injury around the tibia and fibula area, that's the lower leg, so he's had some antibiotics for that as well. Well done. All done now, okay?
You're in Coventry Hospital, okay, because you came in as a trauma.
Roger works as a paramedic, but today he's the one being treated.
So there's a break in the upper portion of the femur there, and there's also a break in the right side of the pelvis, and it extends all the way down towards the hip joint on the right side. So it's quite severe injuries, to be honest. Trying to load some more. Yeah. Okay. Roger?
Yes.
How are you feeling?
Pain.
Pain. Do you understand what's happened?
Yes. I fell out of the sky.
Okay.
What happens when a body collides with a hard surface? If travelling at violent speeds, it can cause fatality or catastrophic trauma to the spine or the head. But landing feet first will absorb the force through the lower limbs, causing potentially life-changing injuries, but a better chance of survival.
So basically...
Is my phone around?
I haven't had a look for that because I was more concerned about your injuries, I'm afraid.
Yes.
I'm so sorry.
Yeah, no, fine.
We'll have a look to see if there's a phone that was brought in.
So the only thing we got that I found off of him was his wedding ring, his watch, and his necklace.
Okay. What's going to prescribe?
I don't think you're going to be paramedicing for a little while.
She's going to be so annoyed.
I'm assuming you're on about your girlfriend. I got a message from the doctor, Hem's doctor who brought you in.
Right.
Yeah, she's on the way.
Oh dear. Huh.
You're going to be in trouble.
Yep. Supposed to be against Tenerife in
the
middle of July.
No comment.
Yeah. Uh-oh. Oh. Hi, honey.
You're right, my name's Tom, one of the staff members here. You've got Andrew, the doctor, over there.
Hello, you all right?
And you've got the young lad who's in trouble in the bed.
Very much so.
Hi.
Hi, dear.
This is just 1 milligram at a time. Oh.
Have some ketamine, have you?
They gave me
A lot. Well, it stopped you screaming anyway. I want to sell you stuff.
No.
You all right?
No.
I had a phone call and I just thought he was joking to start off with. So I didn't really know what his injuries were, and I know what could happen if you fracture your pelvis. Obviously, you can lose your whole blood supply into it. So, yeah, I wasn't too sure kind of what the condition he was going to be in when I got here.
He's had 20 milligrams of
Oh, life.
Who knew? Stupid sport. Thank you, sir. Hello, any resource?
Male 42-year-old car versus tractor, prolonged extrication.
David, 42, hit a tractor head-on, crushing his car. Suffered multiple arm fractures.
So this gentleman went under a tractor, essentially. So he's got a nasty injury to his distal humerus, and he's got a bad wrist fracture. So our plan is to fix both of them. So we'll start with the humerus.
David is struggling with numbness in his hand. Doctors are concerned he could have nerve damage.
I've identified where the fracture is, but we're sort of lifting off the triceps, which is this muscle, and he's got a radial nerve injury, which is likely to be at the fracture site. So we're just going to make sure it's intact.
The radial nerve operates all the lower arm movements. If damaged, David might never be able to do his job again.
So that's your radial nerve here. So it's right at the fracture site as expected. That's your fracture, so that's why he was struggling with extending his wrist.
Using 2 plates for stability, the surgeons must ensure they don't cause even greater damage to the nerve whilst repairing the break.
Yeah? Yeah, go. That might even be the last screw. X-ray there. Thanks.
But David's wrist is a more complicated break.
Wrist might be a bit more trickier, as it's in quite a few bits.
Life-changing injuries can happen in an instant. You might be driving to work or cycling to work, and you might be involved in an accident. As surgeons, we use our hands all the time, and they're absolutely important for me to carry on the job that I'm doing. So I can completely relate to someone who has got a bad hand, wrist, elbow or shoulder injury, which will have an impact on their job and their livelihood. Our aim is to restore them back, or as closely as we can, to the function that they had before the injury. So just be mindful of the nerve which is just here.
The surgeons try to piece the multiple bone fragments back together.
Okay, now pull a bit, put some traction.
An intricate job. Avoiding delicate tendons and nerves, they secure it with a Y-shaped plate.
Well done. Is it right in the middle of the bone? Okay. Usually 14 or something. Step gate. X-ray there, please.
X-ray images show if the screw holes are in the right position.
That's not bad.
If they protrude into the joint, it could prevent movement, which would be catastrophic for David.
Just retract that. Let's have a 20 then, please. Proper compartment, exit a bit here. Keep going in. Yeah, stop. X-ray. X-ray there.
So the things with wrist fractures, the main risks are sometimes the fixation may fail. There's a risk of arthritis in the wrist. There's a risk of injury to tendons and nerves around the wrist as well, which can affect hand function.
Motorbike collisions with cars can cause riders to be thrown onto the road, increasing their chances of injury. 36% of the 16,000 motorcycle casualties in 2019 suffered serious injuries.
Ambulance services, the patient breathing.
He's breathing all right. He's got no pain in his chest. He's literally gone head on with a car.
Male motorcyclist, hit by car, thrown into the road.
Where is he injured?
On his leg, his hip, and on his back.
Hello, Rhesus. Yeah, go ahead.
The patient is 21-year-old Aiden.
Hi, my name's Dr. Daniel. What's happened then?
Got into a motorbike accident. My car hit into me on the roadside.
Did you black out?
I did feel like I was going to go to sleep for when I was on the floor.
Okay, all right. And what bits hurt?
My right leg, and also the bottom bit of the ankle.
Okay. Is that okay? In the groin area at all? No. In here. I'm going to move your trousers. Sorry. Okay. So we'll get an X-ray of that. Okay. We see a lot of motorcyclists, and it can range from having just isolated head injuries to having quite serious injuries within the abdomen, within the chest. We've had people who've had their leg amputated, being in a motorcycle accident, so really quite serious injuries.
Oh, you right? Yeah, I got some bad news. Got into a motorbike accident and my leg might be broke.
Are you kidding?
No, I'm being deadly serious, I swear.
Oh, God, Aiden.
Yeah.
What protects a motorcyclist when thrown off a bike? Helmets help protect from fatality. The hard outer shell, made from thermoplastic or polycarbonate, and a soft inner shell of expanded polystyrene, is crucial in absorbing the energy through impact, cushioning the skull, minimizing the risk of death or brain injury. Gloves, boots, and leathers are the only chance of protecting the soft tissues being stripped from a body.
My son wasn't in from the gym after 3 hours, which is not like him. So I messaged him and I said, "Where are you? Still at the gym?" No reply. And then about 2 minutes after that, I got a call from my son saying he's in A&E because he had a motorbike accident. You've got to watch out for people on bikes and motorcycles because, you know, they're quite invisible sometimes.
No matter how big or small the injury, just hearing that a loved one has come off a motorbike can come as quite a shock. And you know, you expect the worst, you don't know what to think. It's quite distressing.
Roger, 44, crash-landed paramotor. Sustained serious injuries to his thigh bone and pelvis. Faces a double procedure.
So we've got to open up the front bit of his pelvis, and because he's got good bone, he's a young guy, we'll be able to hopefully hold that just with a couple of screws. He's got his femoral fracture, which is going to be a bit more challenging because it's in lots of bits. It's very displaced, which Mr. Ramitar is going to come in and give Ed a hand with.
Trauma is unpredictable. It can range from a road traffic accident to someone falling from a height, be it a building, be it someone who's parachuting. We have to be able to think on our feet to respond to what's in front of us. You can then deal with individual injuries and broken bones and things like that. Quick decisions are needed to save a patient's life.
So you can see the fracture there, yeah?
Using X-ray images, the surgeon can try to realign the broken off piece and secure it into place using clamps.
Yeah, well, that looks nice, doesn't it? It looks in good position. And yeah, why don't we go with a cannulated screw now?
2 screws must be drilled in at just the right angle to go through each end of the fractured off wing, back into the pelvis to secure it. A complex task when the bone is so fragile.
Sometimes, you know, if you hold the pelvis up to the light, you can see light through it. You know, it's so thin, the iliac wing. But yeah, I haven't really got a perfect view for looking at the crest. But I think the best thing is just to do it on feel, isn't it? And know that I'm on the cortex. That's cool, thank you.
If the screws miss, it could cause greater damage and impact Roger's ability to walk.
So we can just use this like a drill. If I can get an angle, get this to dig in there. Can we have X-ray back in? Everybody's still covered? Yeah. To pelvic surgeons, that looks very satisfying. He's going to end up with a fair bit of pain in the recovery period, unfortunately, but we'd hope he'd have good function eventually, but he'll never quite be the same again.
Coming up, surgeons battle to fix Roger's leg.
It's going to be quite challenging. Getting access is very difficult. We just need to get this bit of bone on the other side of the sacrum.
And the impact of a devastating motorbike crash.
If anything, that's where I expected there to be a break.
Great Britain, 340 collisions a day. 1 every 4 minutes. University Hospital Coventry has specialist surgeons on standby to tackle anything that comes in. Roger, 44. Sustained a fractured pelvis and broken thigh bone, crash landing his paramotor.
Good luck with his femur, mate. He's got great bone.
Team 2 have arrived to try and mend his complicated leg break.
So the plan is we're going to reduce, get the bones in the right position, and use a long nail, a rod, to fix his femur. The tricky bit is going to be he's very swollen, the bone's in quite a few pieces, so it's going to be quite challenging. Good, all right. Let's get this fracture reduced out and then let's get this nail down. All right, guys, we're going.
Starting.
is very muscular. So that piece needs to key into there, so this just needs to be rotated a bit like that. Okay.
It requires physical strength to try to pull the leg back into its correct position.
We're trying to reduce the fracture, i.e. get it back aligned. But the difficulty is that it's quite a comminuted fracture. It's in multiple bits, and he's very muscular. So getting access is very difficult. Watson, okay. I'm going to give you a bit of traction, okay? Go. Okay? We just need to get this bit of bone on the other side of the sacrum with you. Okay, 1 second. Ready? So I'm just leaning the top one back, because if you can see, and then let me try to rotate it. Go. You're almost there. All right. I'll be honest. Alignment looks good. All right, come on in with X-ray, please.
To hold the fragments in place, they drill a guide wire through the center of the bone to act as a pathfinder for the metal rod. X-ray images are taken for accuracy.
Okay, stop. Come down to the knee. A bit more down to the knee. And flash. Okay. All right, bigger remote. Keep the guide wire in.
The metal rod is hammered down the canal of the thigh bone. But with the pieces precariously held together, they must take care not to blow the break apart or fracture it further.
Okay, so we managed to get the fracture aligned as best as possible. We've gotten a rod from the top to the bottom to hold it in place. So what we're doing is putting the screws at the end of the nails to lock it on both sides. And then we'll do a little bit more work at the fracture just to hold some of the fragments together. X-ray, go again. Yep, save that one for us. Beautiful. All right. So we're in a home stretch now. We're just closing up, but he's likely to need a second trip to theatre for his leg wound. And we'll obviously we'll monitor and see how his femoral fracture and his pelvic fractures heal up. We're finished with X-ray, yes. Thank you very much for your help. Thank you.
Roger's treatment isn't over. The plastics team will attempt to repair the open laceration to his calf in a few days. Aiden, 21 years old, hit by a car and thrown from his motorbike. He's having an X-ray to check for suspected leg fractures.
Oh, yeah, that's very bad.
He's my only son, and we're so close, aren't we? He wanted to bite like his cousin. Every time he goes out, it just worries me all the time. And I always can't say to him, he wears his jacket, he wears his helmet, he always has his gloves on. But he didn't wear his trousers tonight because he was going to the gym. And he wanted to go straight in there with his jogging bottoms, and he never had gloves on because it's a bit warmer. And now look what's happened. I just can't get over your helmet.
I'm so glad I got a good helmet, man. Like, god damn, if that was a bad helmet and it cracked.
I'm just glad he's safe.
Yeah, helping rehabilitation.
It doesn't matter how good you are as a motorbike rider, you can't predict what the other drivers on the road are like, and accidents can happen at any time. You know, you see those stickers that say think bike, that's there for a reason, because quite often you don't think about bikes. They are smaller, they're faster, and you just don't tend to see them in your wing mirrors, blind spots. You dress for the fall, not the ride, so that if you do come off, you're well protected.
Is this Mum?
Yeah.
Oh, you're not happy? Oh no, it looks the same.
Yeah?
You're going back to work tomorrow, I'm telling you now. Fast as a bruise.
No,
Yes, you are. I'm
don't be
going to make you get to
silly.
work.
Don't be silly. No, I can't even walk on it.
Okay, that's Aiden's X-ray. That's the top part of the leg. That's his kneecap there. Around here was where a lot of his pain was, just around this area. So if anything, that's where I expected there to be a break, but it looks like he was extremely lucky. So X-ray shows that nothing's broken.
Right.
Okay, yeah. Right, so we've done from your knee right down to just past your ankle, and all of that looks okay.
Yep.
Right, so I think what we'll do is we'll let the pain relief work, See if you can be up and walking. And if all's fine, then you should be able to go home.
Thank you.
Okay.
Appreciate it.
And next time, wear full leathers.
No, yeah, no, for sure. Yeah.
Wear the leathers, wear the gloves, wear the full kit, wear the boots. Right, I think you've learned a lesson. Okay. All right, okay, all the best.
Thank you. I really appreciate it. Thank you so much. I'm glad that nothing's badly done. I'm surprised, honestly, because...
So lucky. So lucky.
Yeah, no, definitely. So, thank God for that.
Next time you probably won't be if you do that again. But you're not going to.
Yeah, it's not going to stop me from riding on now. Just need to be more careful.
There's just nothing better in the world to see that your son's okay.
Stay safe.
And you.
I'm going to give you a bit of traction, okay? Go.
Roger had surgery to fix his fractured pelvis and broken thigh bone. The paramotor laceration to his calf is so severe, just stitching it won't be enough. Plastic surgeons will perform a skin graft to try to repair the damage. Skin grafts can be done for people who've skidded on the ground and had their skin torn away from the body. Healthy skin is taken from one area and attached to the injured part in the hope that it heals.
Right, so we're going to give you a bit of oxygen to breathe. Actually, can sometimes feel a bit cold going up your arm. Occasionally, you can be a bit stinging.
What we're planning to do for coverage of the defects to the lower calf is we take an actual thin piece of skin from the thigh and we transfer that down to the calf.
The injured site is prepared for the new graft. A template is used to work out how much skin they need to cover the exposed area.
See roughly what size.
Okay.
Using a dermatome machine, they shave off a healthy layer of skin from Roger's thigh to place over the open laceration.
There are different depths we can go to based on the setting on the dermatome. We sort of went for a slightly thicker skin graft just because of the areas exposed.
So you can see just these tiny kind of speckles of blood coming now, which tells us that it is just the correct depth.
That dressing remains untouched for a couple of weeks to allow the skin cells to grow back, and there's enough remaining in there to regenerate.
In order to make this go a little bit further, we can put the graft through a device which puts in lots of tiny holes in it, and that just not only does it let any fluid or kind of bleeding seep out, but it also means that it can cover a larger area.
It's crucial the laceration is fully covered for protection from bacteria and to prevent infection.
There are lots of actual ways that a graft might not work. It might just not take, and take means that it actually takes up the blood supply from the tissues, and it can actually partially take, and if that happens, we might even need to do the whole thing all over.
After an accident, bony injuries or fractures may be relatively easy to treat. However, soft tissue damage may not only be a physical thing, but also a psychological thing, because even after we've treated the patient, they're still left with scars after the injury, the scar acting as a constant reminder for them of the trauma that they have been through. So the goal in theatre is to achieve the best possible functional and aesthetic outcome for each individual patient.
Coming up, have surgeons been able to save David's arm?
It's been home. Okay.
Will Roger ever walk again? The Trauma Department, University Hospital Coventry. Over 500 emergency admissions per day. Up to 100 major trauma patients a year require input from the plastic surgery team. Roger, 44.
Oh, life!
Crashed paramotor. Suffered multiple fractures and a deep laceration to his calf. Plastic surgeons performed a skin graft to cover the wound.
Morning. Hi, morning, Roger. My name's Sunita for the plastic surgery team. Nice to meet you this morning.
6 days on, they are checking to see if the graft has worked.
You all right?
It's a lot of dressings. This is the first time I've seen my leg full stop, actually.
If you can just roll over to your side, and as you go, I'll take that's it. Up, perfect. Well done, well done. This is just the last bit, my darling. You don't want to cause them any more harm or any more pain. Right, Mohammed, we're just going to have to get the dressing straight on it. It's not just about the injury, it's about their well-being and their emotional feelings and psychological as well. So we're trying to support all round. And down, and relax. Well done, well done, well done. So we would say that's 100% taken. Just needs to be a bit more firm, but it is the first graft check, so it's looking good.
They're happy with where it's at, given its duration, but they are not happy enough to say, yes, kind of, you know, go home. Not really too concerned about that as long as the healing goes well and I can get back to what I was doing.
Builder David had a head-on collision with a tractor, crushing his car 3 days ago.
My girlfriend knew the farmer. I didn't have enough time to turn away, and he didn't have equally enough time to do anything, and any sort of braking or any manoeuvre was just too late, so it's just unfortunate, I think.
David sustained potential life-changing injuries to his arm, which, if left untreated, would make his job almost impossible. The orthopedic team reassembled his arm and wrist, whilst freeing the nerve which controls his wrist and hand movements.
One of the doctors said that possibly I'm going to be out for 3 or 4 months out of work. Well, if anybody knows me, that's just like a red rag to a bull. Like, I'm no way going to be sat about for 3 or 4 months.
And this is your splint, so it's specifically for the left side, self-explanatory.
David will have to rest his arm in an attempt to make a full recovery. But for now, he can go home to his family.
Sterling job you've done.
Okay.
Sterling.
Look after yourself, won't you?
Absolutely.
We'll see you in clinic.
Yeah.
All right.
Yes, you will. Thank you. Oh. Who we got? Smalley. Sweetheart, do you want to tell Mummy and the rest of the girls that I'm coming home in the next couple of 3 hours? Okay. Hello, Bonnie. You all right, Lottie? How you, darling? Can't wait to see you. Here, where's Nellie? Where's little Nell? There you are. Love you, love you, love you. Bye-bye. Bye-bye-bye. I've never been away from my kids this long. I think many a man's just like me up and down the country. Yeah, I'm a total family-orientated sort of geezer who just loves his kids. I can't wait to get home.
His sister Nina has come to collect him.
Are you, Babby?
How are you? How are you feeling?
I'm gonna find it tough. I'm a get up and goer, not a sit down and stopper. Oh, I'm on the home front. Whoop! Hey, home. Cheers, fella. Everything's all right. I've been.
Thank you so much for everything you've done. We appreciate it.
Beautiful.
Roger's traumatic crash landing caused catastrophic injuries to his leg and pelvis. The physiotherapy team want to get him back on his feet.
You can try and reach up to the handles. That's it.
Good. Ready? Big stand.
That's it, that's it.
That's it.
Okay.
Okay, right, we're going to move forward now.
Good. That's it.
Good. So he struggled to bend his leg and struggled to clear the floor, which is why it was so hard for him to walk. So if you can try and bend that knee a little bit to try and give yourself some space between your foot and the floor, then you can walk.
That's it.
Breathe. That's it.
In road traffic accidents and any collision, people can sustain not just life-threatening, but life-changing injuries. These trauma cases, it's not just about broken bones. There can be damage to major structures, soft tissue damage, and even when we fix the bones, it's months to years of rehab for them to recover. There's still no guarantee that these patients will return to normal function.
Right, now weight onto your left. That's it. That's it. Good.
That's it.
Good, good. He's very lucky to have only come off with the lower limb injury. He could have come off it much worse. He could have lost his life.
Stand up from there.
Nice and steady. Okay.
Roger's had 2 weeks of rehabilitation, and the plastics team are happy with the progress of his skin graft.
It looks really good.
Today, he's going home.
Getting there slowly. A long way to go, but definitely looking forward to getting home. Although I've not seen my little bell arrive yet that I ring for assistance.
And nor will you.
And nor shall I. Yes, so...
That's for sure.
Yeah.
He's very lucky. It could have quite easily been, you know, his spine that he fractured. It could have, you know, been both legs. Could have been his chest, could have been his head. So the fact that actually he's still here, a bit of a miracle, really. He's so determined. He's so determined to come home, though. But just I do have some concerns that might be a little bit too soon getting around. All right?
The next couple of weeks, I think, is going to pose quite a few challenges. Learning to cope at home. It's one thing asking the nurses and the doctors that are in the department for help with little things. I think asking Rachel and, you know, other people that are around, I think that's going to be a little bit more challenging. So hopefully they will have some patience with me. But I'm looking forward to it.
Might be a long journey home.
Cheers, guys. Thank you very much.
Sunshine. Look, this is what outside looks like.
So, the big question, will I continue flying or not? I know what Rachel thinks to it. It's something that I would have to have a serious think about. She'll have to find the crew that came and go and see them at some point and say thank you.